I have reviewed the physician's orders, and today I'm going to be suctioning my patient with the trach, and I'm going to be providing trach care. I provided privacy for the patient. I wash my hands. Hey, my name's Cora, and I'm going to be your nurse today. I identified the patient using 2 identifiers. I'm going to be suctioning your trach, and I'm going to be providing trach care. I gathered all my supplies over here. So now I'm ready to suction the patient. Okay, I'm gonna fill this with sterile normal saline. I'm gonna lid the bottle, and then I'm gonna fill this up. Then I'm gonna open this. And I'm gonna put on my gloves. Keep my hands above my waist to maintain aseptic technique. Now I'm gonna now I'm gonna attach this to the suction. I'm gonna have my suction turned up to no more than 125. And I'm gonna test this out over here. And I'm going to hyperoxygenate the patient for 30 seconds up to 3 minutes. I'm going to insert this until the patient coughs. Okay, and I wouldn't suction while I insert. And now as I pull this, I'm going to intermittently suction, no more than 10 to 15 seconds. And then I would put that in there, not knock it over, and hyperoxygenate the patient again for 30 seconds up to 3 minutes. If I needed to suction again, I would wait 30 seconds, and I would alternate hyperoxygenating the patient for 30 seconds to 3 minutes before, suction, and hyperoxygenate after. So now I'm going to dispose of these supplies, not on the floor, in the trash. And now I perform hand hygiene, and I'm going to perform trach care. slip both of these, hydrogen peroxide and normal saline, into the trash. And in the top container, I would fill it up with hydrogen peroxide and normal saline. And in the bottom small containers, I would fill those up with normal saline. Now I'm gonna put on my sterile gloves. I feel like my hand touched the stuff that was laying on top of my gloves, but I would my gloves should have been on top. That way it would have been I would have been able to get those on first before I touch anything in my sterile field. But now I'm going to, just to keep everything else sterile, but now I'm going to remove the inner cannula on the patient's trach. And I'm going to be careful to only touch the outside portion and not the clear inner portion. And I'm going to drop that down into there. Now this hand is dirty, so I can't touch anything in my sterile field. So okay, I'm going to put this in my dirty hand. Okay, now I'm going to remove this. I'm going to clean it. And I'm going to just stay with this. I'm going to drop this in here. I'm going to dry this off. Now I'm going to put this back in. And lock it into place. Okay, now I'm going to remove this old dressing. Dispose of that. Put that in the normal saline. Clean the top portion. Dispose of that. Normal saline. Clean the bottom portion. Dispose of that. Now I'm going to clean the faceplate. Dispose of that. Now I'm going to put a new dressing. I'm going to dry it. Going to dry the top and the bottom of the faceplate. I'm just going to make sure everything's dry. Now I'm going to put a new dressing. not forceps, but I'm just gonna use this to stick this up underneath here. Real life, I wouldn't use this. I'm not trying to cut somebody with some medical scissors. Okay, well, I'm gonna dislodge the whole trach doing this, but okay. I would not touch all this, but these scissors are not working. But I would get that under there sterilely without touching or contaminating anything. Okay. This patient has trach ties, but my trach ties are on the patient. They're laying up here. But this is mine, and she already has some up here. So what I would do is my ties, and then I would tie one side. Then I would have somebody holding this into place because I didn't just dislodge it when I put this dressing on here. I didn't do that, and it's still in place, so somebody's going to come hold that, and I'm going to sit the patient up. I'm going to have it tied on one side. I'm going to sit them up, and we're going to get it on the other side, and then we're going to tie it on the other side, and I'm going to stick 2 fingers under there to make sure it's not too tight, and then I'm going to cut the old ties loose. And I would dispose of all my supplies in the appropriate containers. And I would make sure my patient's in a comfortable position and that her side rails are up and her call bell is within reach. And I would document the trach care and the suction.